Good afternoon, everybody, and welcome to Medicare Monday for May. I'm Jenny Lewis with the Area Agency on Aging District 7. And as always, we have our friends from the Ohio Senior Medicare Patrol, Jody Roberts, and from the Ohio Senior Health Insurance Information Program, Amber Cup. Welcome, ladies.
Hi.
Hi.
So nice.
Happy Monday.
Yeah, happy Monday. And it's a Medicare Monday. So we're here and happy to share information as always, updates for Medicare beneficiaries, news about scams, any kind of information that can help you all stay safe and healthy, and also share information with you that's important and relevant for today. So today we're going to talk about a couple items. We're going to talk about the next generation MyCare plan that's coming up very soon in our district. And then we're going to talk about Fraud Prevention Week and talk a little bit with Jody about that. But first, we're going to talk with Amber about next generation MyCare. I know we've heard this term a lot in our world. We're trying to make sure our public understands it. So Amber's going to talk with us a little bit about that and how that's going to affect Medicare beneficiaries.
Yeah, absolutely. So I'm Amber. I'm from the Ohio Department of Insurance in the OSHIIP division. And so MyCare, its full title is Ohio MyCare Next Generation or something like that. But basically what it means is if you are someone who has full Medicaid and Medicare, then you are eligible for a type of plan that forces Medicaid and Medicare to work together. So when I say full Medicaid, I mean that it has to be Medicaid. It can't be a Medicare savings program, which unfortunately is a category of Medicaid, but you have to have the full Medicaid in order to be eligible.
Okay.
And like I said, basically MyCare forces Medicaid and Medicare to work better together. You do have some options if you are someone who's eligible for this program. And in the AAA 7 region, MyCare is going to be rolling out starting in June. So starting in June, if you are eligible for this program, you're going to be receiving mail about it. This mail is either going to come from Job and Family Services or it'll say Medicaid on the envelope. Just make sure that you open your mail and you're reading it. This is a really kind of complicated new thing to this area. So the goal of it ultimately is to have one point of contact for someone who's navigating both of these systems. So, if you are eligible for this, you are eligible for kind of some extra additional benefits when it comes to your Medicaid and Medicare. And you're eligible to have a point of contact who can help you get through all of the processes of going to the doctor, understanding your diagnoses, all of those things. So when mail comes, it's going to start June 1st. It'll have information about what's available to you and what your options are. But we were talking before, I could talk about MyCare for 2 hours and it would still probably not make a lot of sense. So, when you get your mail, feel free to call. You can call the OSHIIP hotline and we can talk to you. I know that the AAA 7 has fantastic resources. And Jenny, if you want to talk about, how to access those. But yeah, so with the MyCare, it has the potential to be a great advantage to people who are eligible for it. And you do have some options when it comes to that. But yeah, you just have to, call us, make the call and we can help you. If you do nothing, so let's say you receive the information in the mail and you don't make any choices, whatever they send you in the mail, they're going to tell you what will happen if you do nothing. And usually it'll be a change to your Medicaid. So they might give you a different service provider. So the options are Anthem, CareSource, and Molina. So the letter you receive in the mail will just be telling you, if you're going to be getting a new managed care provider for your Medicaid. Your Medicare will not change. So whatever you have for your Medicare, it's not going to change unless you change it yourself as the Medicare beneficiary. So we always like to emphasize that. Your Medicare will not change. Your Medicaid might change. And if you don't want that to happen, then you just have to call. And It's that easy.
Wonderful. And I'm glad that you are sharing the fact that they will be receiving a letter, because we always talk here about receiving letters and phone calls and whatnot. So, and we always are talking about scams and scams prevention. So make sure you open that letter and read it in its entirety. There will be contact information, I am sure. If you have questions, it's confusing for you, you don't understand it, please reach out to a number of different agencies. We are one of them that we can help you answer those questions. If you're actually one of our consumers through one of our Medicaid waiver programs, you can speak with your care manager. You can call our 1-800 number. We have a lot of information on our website that is specific to Next Generation MyCare. If you go on our website at AAA7.org, you will see under the current update section at the bottom, there will be a button specific to Next Generation MyCare. So just click on that. That will take you to the Ohio Department of Medicaid website, and there's a lot of great information there. Like Amber said, we're just kind of giving you a 30,000-foot view of this. We would have to be on here for a couple hours to go through it all in very, very detailed information. So just want to let everybody know that it's on its way to this district. June 1st, you will be receiving those letters. If you have questions, please do not hesitate to contact someone. You can contact our agency. You can contact OSHIIP. Anybody will be happy to help answer those questions for you. And if we cannot, make sure that we send you to a resource that can assist. Anything else with that, Amber, that you can think of?
No, I think that that kind of sums up the big picture idea.
Okay, wonderful. And like I said, pay attention to our Facebook page, our website. We'll have lots of information. And as always, if you have any questions, our phone number is there on the screen, 1-800-582-7277. You can also email us at info@AAA7.org. So turning it over to Jody, who's going to talk about Fraud Prevention Week.
Thank you, Jenny. Yes, I wanted to tie in our upcoming Fraud Prevention Week, which for the Senior Medicare Patrol runs the first week of June 1st through the 5th, because it's the 6th month, and through the 5th because most people start receiving Medicare when they turn 65.
Oh, nice.
Oh, that's a good idea.
Yes, I learned that today. So that was an interesting little
something every day
in the back pocket there. But Fraud Prevention Week is just a great time to remember that scammers are always actively looking to acquire Medicare numbers so that they can commit fraud and steal from the Medicare Trust Fund. We lose over $60 billion in any given year. And a lot of this is because Medicare is not a one-size-fits-all program, right? And we learned, like with MyCare, you could be talking for hours. It can be complex. It can be confusing. And so people may feel a little bit lost as they're navigating the Medicare system. And because of that, they may think, well, yeah, I'm going to give them my Medicare number because if help is available, or I may be able to get this item for free or these groceries for free. Why not give them my Medicare number? But that is one of the key ways that fraudsters then will take advantage of that information and use it to submit claims for items and services that were never provided to the beneficiary. So we just want to come in and remind people that that Medicare number is just as valuable as your Social Security number or your bank account information. Don't give it out. And work with somebody who's a trusted source. If you have questions about your Medicare coverage, work with our friends at OSHIIP or talk to, the Area Agency on Aging and say, I have questions. Who can I talk to so that I'm not giving out my information to somebody who may seek to do harm?
That's right. Of course.
So that is a very important thing coming into the Fraud Prevention Week that we wanted to cover.
Sure, of course. And then you also wanted to talk a little bit about your Pro Seniors Helpline. So let's talk a little bit about that.
Yes, thank you. So in Ohio, Pro Seniors gets the federal grant to run the Senior Medicare Patrol program. Senior Medicare Patrols are all over, all of the 50 states have one. 4 of the U.S. territories have a Senior Medicare Patrol to help combat fraud. But in Ohio, we operate out of a nonprofit called Pro Seniors. And one of the additional services that they offer for any Ohioan 60 or older is a legal helpline. And that's the opportunity to call in and have an appointment scheduled where you can talk to an attorney about a whole bunch of different legal questions. Often, though, they will get calls related to Medicare, Medicaid. Maybe you think that you qualify, but then you got a denial letter and it doesn't make sense to you. And you're like, I don't know what to do with this. Maybe you have questions regarding Medicaid estate recovery. Maybe it's not even related to benefits. Maybe it's related to a housing or a debt issue. And you just want to know, what are my rights? What are my options? Pro Seniors is a great resource to call, schedule that phone call with an attorney, and at least get some initial information. And if additional help is needed, they will try to connect you with somebody locally. But that phone call is always free. And again, any Ohioan 60 or older, regardless of income or assets, qualifies for that initial call.
We love that resource. I share it often. We actually have a handout when we go out to the community to share about the helpline. We receive questions often, legal questions, and it's nice to have a partnership with Pro Seniors so that we can share that helpline information with them. Like you said, Jody, you have that free 30-minute consultation. So nice to have somebody who's in that legal world answer those questions and help you navigate through some of the questions that you might be experiencing as we age, or just any kind of particular situation that might be outside of your comfort zone and knowing what best to do. So right there on the screen, 800-488-6070. Jody, when is that line open?
Ooh, you would ask that question. Well, it is Monday through Friday from 9:30 until 2:30 is when the appointments are made.
Okay, perfect. So right there on the screen, you can call that number and set up an appointment to have that 30-minute consultation if you have any kind of legal questions that you need assistance with. So ladies, lots of great information today. Anything that we have forgotten or that you have thought of along the way today?
Nope, I think I'm good.
Well, let's run through some numbers here just to remind you. So we are the Area Agency on Aging District 7, AAA 7, 1-800-582-7277. You can also email us at info@AAA7.org. Our website is AAA7.org. Lots of great information there, including the next generation MyCare information that we just talked about at the beginning of our live stream today. Ohio SMP, Ohio Senior Medicare Patrol, 1-800-293-4767. If you feel you've been a victim of a scam with Medicare, please call them. They will be happy to assist you. And most importantly, help you with a new Medicare number and also educate others on possible scams that are out there. We like to make sure we let people know about those. Another number we want to share here with you is OSHIIP, Ohio Senior Health Insurance Information Program, 1-800-686-1578. You can reach them via email right there, OSHIIPmail@insurance.ohio.gov, and their website is insurance.ohio.gov. So as always, we appreciate our listeners, our viewers here with Medicare Monday. We will see you back here next month. Topic to be determined. We always like to check to see what's going on. So until then, hope you have a wonderful rest of your May. Please stay safe and healthy. Take care.